Hi, everyone. My name is Kat. I own a psychedelic medicine clinic in Portland, Oregon, and I'm also a worldwide public speaker and educator who has spoken at large conferences like South by Southwest in Austin and Psychedelic Science in Denver regarding legal, regulated psychedelic therapy. Now, I want to start with a pretty bold statement, and that is that psychedelic therapy is the most effective way to permanently alleviate mental suffering based on adverse life events from the past. So the purpose of this short crash course training video is to explain why that statement is true and hopefully equip you with the knowledge that you need to make an informed decision of whether psychedelic therapy could be right specifically for you. So I want to invite you to invest the next few minutes to learn about some useful knowledge about a new topic that most people don't know much about because it could lead to a future happier you. Now, this video isn't about underground, illegal, or recreational psychedelic use. And it also isn't about ketamine therapy, which does have some psychedelic properties as well. This video is exclusively about the safe, legal, and regulated use of psilocybin to treat common mental health disorders. For those who aren't familiar with the word psilocybin, this is a natural organic substance found in over 200 species of wild mushrooms that grow all around the world. Throughout this presentation, I'm going to stay away from the words magic mushrooms or shrooms due to the negative connotation and association with illegal or irresponsible activities that make those terms negative. So instead, I'd like to focus on the actual science. Psilocybin is a molecule that belongs to the tryptamine class, which is the same family as the amino acid tryptophan. Now, tryptophan is the amino acid that makes you sleepy after Thanksgiving turkey dinner, so most people have heard of it. Tryptamine molecules are precursors to the neurotransmitter and hormone serotonin. In fact, psilocybin's bioactive form is so similar in structure to serotonin that it is not inaccurate to say that tryptamine psychedelic therapy is akin to serotonin therapy. And I'll explain more about how that works in just a minute. This training really, though, is for people who feel stuck or struggling mentally and emotionally, and also are actively seeking new solutions that actually work to improve their mental health. So I am about to teach you how professional legal psychedelic therapy is safe and effective. But before I do that, I just want to be clear that although these substances are overall safe and non-toxic, due to their very powerful effects, they are not for everyone. So to begin with, there's an age restriction. You should know about that. Legal psychedelic therapy is not for people under the age of 21. Oregon and Colorado are the only two states with legal regulated psilocybin therapy programs as of 2025, and neither state allows clinics to serve people who are under the age of 21. There are some other safety contraindications from a medical and psychiatric behavioral standpoint, right? So my team and I have produced a psychedelic therapy master course. And it goes beyond all of these things, in more depth, right? It goes beyond what we're going to talk about today. You can get that on our website, or you can get it for free if you become a client. But the high level summary is that if you have a significantly unstable mental or physical condition, psychedelic therapy may not be right for you. Note that my focus here is on the word stability of a condition, not necessarily severity. So for example, we see clients all the time with very severe depression and anxiety. We see clients who have pretty severe addictions or other things, but we do not see people with destabilizing disorders such as, for example, paranoia, delusion, psychosis type of symptoms. We do not see people who are in an active crisis or having active thoughts of harming themselves or others. So there are several more conditions to consider when deciding if psilocybin therapy in particular is safe and appropriate for you. So to dig deeper, I would recommend you could purchase our master course if you would like. It's a fantastic value for trustworthy curated content, or you can just book a new client consult with me and I will discuss your personal situation with you. But for now, I'm just doing my best to keep this video short and summarized. So let's just dive right in. Psilocybin is an extremely effective mechanism at helping people feel less sad and depressed and also less anxious and fearful. It does that because it helps people process grief and prior adverse life experiences, whether these happened in adulthood or childhood or both. Psilocybin also helps provide clarity to those who are suffering from burnout or feel a lack of clear purpose or path. Now, the defining characteristic that we see in our clinic every day and that all our clients share is a feeling of struggling to get better, yet feeling stuck. Those are two words that people use all the time, right? There's an inner conflict between the life that they want to be living and the life that they actually are. And so many of us are in that boat. I totally get it. And ironically, despite our best efforts, this gap often widens over time, which can be super, super frustrating. Now, the current models for mental health treatment and care have been around a long time, right? There hasn't been much new innovation in mental health care for several decades. The SSRI type antidepressants hit the market in the 1980s, and talk therapy in various formats, of course, has been around forever. There have been new flavors and variations of these two things that get introduced or marketed differently over time, but the core mechanism of both of them remains basically the same. Now, it's my opinion that talk therapy and medications are most effective and appropriate when someone is going through an active crisis or problem. Talk therapy is by far the best way to receive professional human support when you are going through a tough time, right? Like a job loss or a divorce. And medications, of course, are intended to manage, aka suppress, physical and mental symptoms that are uncomfortable or just downright intolerable. But neither of these things are really intended to be forever, right? And sometimes, especially with things from the past that have gotten stuck, they aren't as effective in permanently healing those things to eliminate the associated symptoms, such as feeling depressed or anxious. Most versions of talk therapy also, they limit clients to understanding their pain by processing it in their prefrontal cortex. Only specialized therapies like EMDR and brain spotting will access areas of the brain where core wounds and traumas are actually stored, which is back here in the limbic system. And everyone who's experienced something traumatic knows that you can't think your way into healing from it, right? Your nervous system doesn't really care how much you understand your trauma or your prior pain. What it really cares about is whether you feel safe and at peace. So this is why understanding what has happened and why it doesn't always or often lead to a feeling of true permanent healing and peace. On the other hand, let's talk about medications for a minute. Medications have always been designed to manage or mask undesirable symptoms. That is how they're designed to work. They aren't designed to heal people's emotional pain. They're just designed to suppress intolerable symptoms. And while they can work great at this, it often can lead to side effects, as most of you know who are on an antidepressant, for example, like feelings of numbness or flatness that also just kind of strips the joy from life as well, right? And so I mentioned SSRIs. Those in particular work on the serotonin 1A pathway in the brain. The 1A pathway of serotonin pathways in the brain are associated with something called passive coping. Passive coping means that you increase the tolerance to pain, but you don't actually truly address it. You just make it easier to tolerate and easier to manage. But by contrast, tryptamine psychedelics, they also work on serotonin, but they act along the serotonin 2A pathway. It's a different receptor subtype. And this is associated with active coping. And that's why so many people during a psychedelic therapy session will actively work out their problems, either cognitively or emotionally, or most oftentimes both. So active coping has an exponentially greater association with lasting permanent alleviation of symptoms because it's addressing the core reason for those symptoms. So in order to truly address mental health symptoms, you have to address the root cause of them, right? And that's why so many current mental health treatments fail to work to address a client's mental health struggles all the way, right, over time. Sometimes people don't know what their core wound is, or they believe that they don't have one, but they know that they're suffering anyways. And the cool thing about psychedelic therapy is that it can actually help you uncover subconscious areas of memory or your brain that have things in the past, pain that you might not have even been aware of, or you've repressed so fully that you've become completely dissociated from it. We in the industry call this process excavation, and it can be really transformative, especially since psychedelic therapy sessions last about 5 to 6 hours. It's a good part of a day, an afternoon, and a lot of work can be done in that time. Now, the active coping that's involved in a psychedelic therapy session, it consists of 2 steps. So step 1 is opening up to feel our feelings, which I know is scary. This most often consists of sadness, right? Because sadness is the emotion of letting go. A lot of people aren't aware of that. But sadness is necessary. It's necessary to feel that emotion in order to release what's been hurting you from the past. And we regularly see that clients who refuse to cry or they're scared of crying, these are people who have a tough time letting go, or they're people who are afraid to feel vulnerable because vulnerability is scary, right? And I get that. But when you are able to let go and let yourself feel vulnerable and experience also the feeling of safety and nurturing, when you do that, that in and of itself is just incredibly healing to the nervous system. If you've had difficult things happen to you, you need to grieve those things, that you can't keep sweeping it under the rug. So as I said, we need to be sad. And so by doing this, we can process and release those stuck feelings, right? It's the stuck feelings down deep that are keeping us miserable and causing the so-called treatment-resistant symptoms like depression and anxiety that some people have suffered from for decades. And unlike ketamine, psilocybin is actually an anti-dissociative. So for people who are used to dissociation, distraction, or numbness, sometimes for most of their entire lives, this is something to be aware of and to prepare for before you ever agree to take psilocybin. And that's part of a thorough and comprehensive preparation session with your facilitator, a professional who can guide you through those things. Okay, so we talked about step 1. Step 2 is that we need to bring our nervous system back into balance, right? Chronic mental health suffering happens when the nervous system is stuck in a dysregulated, overactive, or underactive state. So with anxiety or substance abuse, often the nervous system is stuck in an overactive state. It's scanning the horizon, it's jumpy, it's waiting for the rug to be pulled out from under you again, right? It's easily triggered. And we can become preoccupied with worry and rumination. And it's all because something bad has happened in the past and our brain categorized it as a threat to our survival. So now it wants to stay vigilant and prevent it from happening again. This is something called fight or flight mode. Most of you have probably heard of that. You're just always ready for action, but over time, this is absolutely exhausting. It can lead to burnout and despair. And then on the other side, with depression and dissociation, right, it's the opposite. Your nervous system is so stressed out, it has shut down as a protective mechanism. It's gone into freeze mode. So you end up feeling numb or flat or apathetic. The people I talk to with depression, obviously they want to feel their feelings, but you've gone without so far, you just can't access or label them. So depression is also associated with rumination, but rather than scanning the future for something going wrong, usually depressive rumination is associated with the past. So rather than worrying, there could be an incredible amount of guilt or shame or sadness that's associated with the past. So if this is resonating with you on either end of the spectrum, or even if you are lucky enough to oscillate between both, right? I say lucky, but not really. I do have some incredible hope to share with you. Grieving, processing, and rebalancing the nervous system is exactly what psychedelic therapy does. It doesn't work the same way as the old methods you've already tried. Unlike talk therapy and medication management that we talked about, which can also sometimes take months or years to feel better, if at all, psychedelic therapy is very, very fast. In fact, it's so fast that once you're ready for the actual session, it works in one afternoon. Right, it's one session of 5 to 6 hours, and that usually addresses a core wound entirely if people are properly prepared and they're ready for that session. So because of this, we like to call psychedelic therapy an intervention style therapy. It is not meant to be something that you do all the time. Most of our clients only need one session. And after 3 or 4 sessions, we've actually found a law of diminishing returns. So sessions can even eventually turn more harmful than helpful if you keep going, right? So that's not what we're after here, to keep having to bring you in for regular ongoing maintenance. You will get, in general, the most benefit and value from your very first 1 to 2 sessions, so long as you make the most of that time and you don't resist or reject the experience. Now, there's a lot of misinformation out there regarding psychedelics in a therapeutic context. Many people who have heard of psychedelic substances might have heard that these substances are addictive, that they have no therapeutic benefit, or that there's nothing you can do to minimize the risk of having a quote bad trip. Many people also believe that doing it on your own is just as effective as doing it through a professional program with professional guidance and accurate dosing. So none of these statements are true, right? These aren't true. And educating people on the facts of psychedelic therapy is something that I am super, super passionate about. So, so let me address each of them briefly. Psychedelics are not addictive. First of all, because they don't work on dopamine. Dopamine is the neurotransmitter that is commonly associated with the addiction loop. Tryptamine psychedelics actually mimic serotonin, as I mentioned previously. And a cool thing about serotonin is that in the human body, serotonin receptors have a natural balancing mechanism where if they receive too much stimulus, they desensitize and downregulate themselves, up to and including completely shutting off so that no more serotonin can attach for a little while. And this is why people who are trying to take psychedelics too frequently, as an emotional addiction would be, they can't actually do so, right? The tolerance builds really quickly with tryptamine psychedelics. Now, I want to talk about a bad trip really quick. The risk of having a quote bad trip, that increases exponentially when you are in an unsafe, loud, or chaotic setting, right? And also when you have no idea what your actual psilocybin dose was. I want to say mushroom weight by grams is not a dose because there is varying potency of psilocybin analyte inside mushrooms. Also, a lot of times people will inadvertently or on purpose mix other substances in with their day or their evening. Alcohol and cannabis are two very common ones, and those increase the effects of psilocybin substantially, right? And a lot of people don't know this. Furthermore, a lot of people just don't prepare properly. They throw a few mushrooms into their mouth and they just hope for the best or assume that everything's going to turn out fine, which is obviously not the case always. So these are some reasons to work with a professional program and not try to DIY it, especially not at these larger therapeutic doses. Most reports of taking mushrooms DIY for therapeutic benefit that I've heard have positive outcomes in the 20 to 25% range. So it does work for some people who do go through proper setting and preparation and et cetera. But a lot of people try it and it doesn't work, so then they claim it doesn't work, right? And they'll frequently have either a completely underwhelming experience or maybe an overwhelming experience. And so they're like, this was terrible. Either way, it didn't work for me. A professional model, on the other hand, it can achieve positive outcomes of up to 95%. That's what we've seen. And that's because hundreds of elements throughout the client journey, from the very first touch point to the very last, have been designed specifically for both client safety and client maximum positive outcome. So this level of thoughtfulness also, it virtually eliminates the risk of the so-called bad trip. At my center, Fractal Health, we have developed a success model for psychedelic therapy that contains 9 different facets, all of which contribute to client safety and positive outcomes through lasting transformation. These 9 facets all work together to deliver the maximum positive outcome, right? And our clients get that entire model with support before, during, and after their session. And it is mainly this model, along with our team's professional expertise, that's responsible for our current 95% client positive outcome rates. On the other hand, people taking psilocybin intentionally in their own home, they might only get 2 or 3 of these facets right, and they won't benefit from having a collective team of experts who have learned through serving 500 clients, right, to continue refining our approach. So finally, I just want to differentiate between a bad trip and a challenging session. So sometimes our clients have challenging sessions, right? Either emotionally or physically or both. But afterwards, they feel a lot of gratitude and they frequently state that they received exactly what they needed. We consider this a productive session for the client. Psilocybin really likes having a job to do. It just does. It is a workhorse. So when clients come in with a specific ask to feel better or to stop suffering, and they're willing to, participate fully in their session, the results are universally positive. So I just want to close for a moment with some words of wisdom. Whether you are aware of this or not, we are our own worst enemies. Right? It's not the world. It's not the opposing political party. It's not a war going on in another country. It's not your toxic boss or your relationship status or lack of money. Of course, all of those things can substantially impact our mental health. But in terms of your own mental health, you will hold yourself back more than any other factor. And it's usually through fear of making a wrong choice or just fear of the unknown. But there's so much learning and growth in the unknown, because if you think about it, what you know is all you've tried so far. And if what you've tried hasn't led to the results you want, then you have to try new things to get different results. So my truth bomb of the day is that fear sabotages abundance. And this is something we talk about with our clients a lot. Human fear survival mechanisms are highly attuned to resist change and seek familiarity, even when that familiarity is suffering. It's like the devil you know, right? Now, this isn't our fault. This isn't your fault. What has happened to you in the past is not your fault. Our habits and beliefs have been hardwired into us from birth without our consent. This is a reality of the human mind and human evolution, and the structure that's responsible for it is called the default mode network, which I talk about in great depth in our psychedelic therapy course, and also we talk about it during our preparation with our clients. Here's how it works. Most of us are born with the cards stacked against us, right? Especially as tender young children, those of us who have somehow had to survive the atrocities of abuse, neglect, and abandonment by the very people who brought us into this world. And if that applies to you, I am so sorry. It applies to me as well, and I know it's not fair. But as an adult, you can reprogram those beliefs by loosening the rigid structure of your brain's default mode network. You can heal those old wounds that are held in your limbic system that you've found you can't think your way through to healing. You can get unstuck. You can move forward and you can live life with joy and peace. I know it's possible because I did it myself after 2 decades of believing that I was just stuck with my childhood triggers and pain. And I've now overseen hundreds of client journeys, some of whom are in their 60s, 70s, and even 80s, who are finally finding peace after a lifetime of trying new things that haven't worked. This is how psychedelic therapy works, right? The brain's default mode network and limbic system are rich in these serotonin 2A receptors that I mentioned. And psilocybin works profoundly on these areas of the brain, which are simply inaccessible in a typical state of consciousness. This is the key reason why psychedelic therapy is effective when other modes fail. Other modes aren't directly accessing the limbic system to eliminate the fear response and reintegrate our traumatic memories to make us feel more whole. Other modes aren't physically suppressing the default mode network that's responsible for these rigid thought patterns, often full of harmful or limiting self-beliefs by the time we reach adulthood. Now, psychedelic therapy isn't about hallucinations or seeing pretty patterns on the wall. If you leave this video today with learning nothing else, please know that. What it is about is deep internal introspection and physical changes in the brain that will allow us to approach prior adverse events and beliefs from an entirely different perspective. It allows us to step up outside of our normal day-to-day operating mode and to see things as a higher functioning, wiser self. And it can reveal our deepest values and identity markers, some of which are absolutely precious and sacred to us, but have been repressed or rejected by societal or cultural narratives. Statistics show that 60% of people will never act to change their situation. They are so afraid, and fear is ruling them so much they will never lift a finger to try to improve their lives, and that is absolutely heartbreaking to me. Another 30% will try but fail because the instruction booklet that they were given is faulty, right? So they keep using outdated old methods that don't work. Or sometimes they're so tightly embedded with the identity of their own trauma or diagnosis that they actually fear success because they fear the true change and disruption that will inevitably come with it. But the final 10%, they get it, right? They seek and they quest and they don't give up. And even though they might fail several times, they keep moving forward and eventually they achieve the success in the transformation they seek, in living the life that they deserve. Now, We're humans and we're always going to struggle, right? This isn't some utopian miracle cure where everything in your life will magically be perfect. But struggle should be, in my opinion, 20% or less of the life that you're living now. And for most people, struggle makes up more like 80 to 90%, right? So ask yourself, what would your life be like if your current struggle ratio were reversed? Instead of struggling 80%, if you felt good 80% of the time and you built resilience and a calm nervous system to be able to deal with that other 20%. So I will tell you this, you will get there. I believe in you. I don't know where you are in the continuum of what I just described, but you're on your own timeline and that's okay. You'll get there whether it's tomorrow or in 10 years. My main message to you today, if you're stuck and struggling with mental health or burnout or grief, is A, please just hang in there, and B, to know that there is something out there that can help soon, if and when you have the courage to act and grab onto that future you deserve, if you're feeling that this is right for you. So right now, if you're ready to apply, you can do that right here on this page, and you can schedule a consult to speak with either me directly or a member of my senior leadership team. And I know that only about 10% of the people who view this page and this video are going to be ready to do that, and that is okay. We want to honor where everyone is at in their timeline. And if that is not you, but you're wanting more information and you're in learn mode, you can go to our website at fractalhealthpdx.com and you can purchase our in-depth master training course or look at some of our free articles and content on there. But our training course has hundreds of hours of research and curated content that's been collected down into one value-packed 2-hour training that's further broken into 10 to 15-minute episodes, so it's not too overwhelming, but it's got everything you need all in one place. So this is perfect for people who are in learning mode, right? But you're not ready to act, and that's okay. This is important though. If you are in learning mode and not in ready to move forward or act mode, I do want to ask you that you not apply and schedule a consult with me, right? I try to reserve my consults for people who are ready to move forward. Our consults are only 30 minutes, and that is not nearly enough time for me to personally teach you hours worth of training that you could get much cheaper and faster through our training, right? Or on our website. So my consults they're not for the primary purpose of free education to the general public. They're not sales calls, right? I call them intake appointments. Obviously, there's no obligation, but they are for people who are seriously interested in moving forward. And of course, we can talk about anything specific to your situation, any questions or concerns you have. But I want to make sure mainly that this is safe for you and that it's appropriate for you at this phase of your life. So I'll end here. Choose whatever option best fits what you need right now. And either way, I am so grateful for the time that you spent with me today, and I hope to see you on the other side.